Enterprise Park. Unfortunately, the postcode was taking them via the old entrance and not the new entrance. The old entrance was closed. The new entrance, I don't know if you know Hogwhistle, but the bypass, there's a new roundabout on the bypass, and that's the new entrance into the site. Consequently, because people couldn't get to it, they were stopping, going to local garages, going to local places saying, where's the testing centre? Which again was worrying, because these were people potentially with COVID-19 going for testing, and people in Hogwhistle were terrified. This has happened twice, actually. The dates were the 9th of April to the 11th of April, and the 15th of April till the 17th of April. And once again, nobody knew anything about them, county-wise or not. And people were coming also from Cumbria to Hogwhistle to be tested. So that may distort some of the figures, actually, for Northumberland, because there weren't all Northumberland people. Some were from Cumbria. It's water under the bridge now, but it's just to flag it up and don't let it happen. Well, it's not up to us, it's up to the army and the government, but it shouldn't be happening. They should get their act together properly and liaise with with local authorities to know what is going on in their own backyard. Thank you, Chair.
I do. I mean, I completely sympathise with everything that you've said, and your frustrations were shared with everybody else in the council. I mean, that location was set up to support West Cumbria LRF, not the Northumbria LRF. And actually, we were only told at the last minute, as a courtesy, although not much of a courtesy really, that it was being set up. I think the military were put in a very difficult position, because they were just told by the Department of Health and Social Care to start, to put these mobile testing units in place. That was their mission, and they got on and did it, completely disregarding all of the other bits of the system that it would have been useful for them if they'd involved them. But I think we're getting to a better understanding with the mobile testing units now. At least we do get a weekly forecast of where they're going to set up now, and have a better understanding about how they work, but still have very little influence over when they come to the county.
Okay, Chris, who was next, Chris?
I've got Councillor Dunworth.
Hi, thank you. I've got a couple of questions that I want to ask, but I just want to start by endorsing really what Ian said, and also I think that and the issue around schools and lots of other things is indicative of a real problem there's been with government making announcements, making decisions, not just not consulting the local authority, but not having conversations, not having discussions to actually work out what's best or given leeway for it. Because I'm really concerned about the schools issues in the year 6 as opposed to year 4, because in my area, we're a 3-tier system, and it's the year 4s we want back in school, not the year 6s. And I am getting letter after letter after letter from parents in first schools. The reality is that some of those first schools are so small, there is no way they can take in another year group as well as the year 6 and do the social distancing. And if somebody had spoken to somebody who understands education across the country, that could have been avoided by giving local discretion to local authorities to be the most sensible year group, not the year group that they picked out of thin air, as far as I can see. But I think the reports that we've got today shows a disconnect between having those discussions beforehand when organising a response to this epidemic, that announcements are made at night, communications briefings are sent out to chief officers in our authority over bank holiday weekends, changing the directions that are being given. It really isn't the way to respond to a major public health issue. So with that in mind, one around testing and the test and track, Liz, We obviously started doing that because that's what public health does. That's what we know actually helps us control diseases like this. That was pulled for no apparent reason and just stopped happening altogether. I'm getting reports that the new system is not working very smoothly still at the moment. Is that right, or is it up and running and, you know?
So I think part of the reason why contact tracing stopped in the first place was because actually when we went into lockdown, the behaviours that we want people to do if they're identified as a contact, they were doing. So if we identify a contact, or if we identify a case, we would want them to self-isolate, and we want the contacts to self-isolate, and actually everybody was self-isolating anyway. So the added value of contact tracing in that context was argued to be slightly limited. I mean, I think in terms of the contact tracing that we've or NHS test and trace, it's fair to say that it's a work in progress. But all I can say is that, I have regular meetings with Public Health England, 3 times a week, in almost daily communication with them on one issue or another, and they are working incredibly hard to make it all work. But it is far from perfect.
Surely there's a risk, Liz, with lifting lockdown restrictions before getting that test and trace in place, because people are out there. We've all seen it mixing very freely, actually, but even with what they're allowed to do. So I would have thought it made more sense to make sure that system was working and was robust before lifting restrictions, particularly on those shielding groups. I'm not a public health.
Sure that this is actually
sorry, I'm not a public health expert, but I would have thought it made sense to let shielding people out before you let everybody out, in a way.
Yeah, I mean, I think sorry, go on.
I'm just going to say, be careful here, because what we're doing in Northumberland, what you're referring to, I think, Susan, is government decisions which we have no real control of.
They affect our residents, therefore we have a right to discuss them. They affect our residents.
Yes, we have a right to complain. Yeah, Liz.
Yeah, I mean, it's. I think the Association of Directors of Public Health have taken a view on the the relaxation of multiple measures at the same time, but we have always had processes in place to identify cases in high risk settings and to manage those. So even when NHS test and trace wasn't up and running, there was still a mechanism in place to identify care home residents and high risk members of staff and members of the community, and to address those. I think the important thing is that for the aim really is to try and prevent a second wave of infection, and actually if we all stick to the rules about, as I said before, about social distancing, hand hygiene, and minimizing our contact with other people, then actually the risk of us getting into a second wave will be minimized.
I've just got one final question.
Okay, thank you very much.
And it relates more to the medical, and I'm wondering what is happening with those other illnesses that Liz talked about. So what's happening with cancer care, with those planned surgeries that there might be, because obviously there's a lot of people who've had no care for 3 months nearly now.
So I think the NHS definitely have a plan in terms of how they switch services back on. Cancer services will clearly be a priority, and some individuals will have continued along their cancer care pathway during this process, but clearly others won't. But I suspect there's probably going to be, as people start to access care with more confidence, I think there probably will be a bow wave of cancer referrals that the trust will need to accommodate. Claire, I don't know whether there's anything more that you want to add.
Yeah, no problem. So we have definitely continued to treat cancer patients as part of during lockdown, and we put the necessary safeguarding in place to protect both patients and staff as part of that. In recent weeks, we have started to open up what we would refer to the pipelines for some of the planned care, and that is starting to come through. And we initially anticipated a bit of anxiety coming into our hospitals, but we haven't necessarily seen that. And when we have rang up people to book them in, they've been more than comfortable to come into hospital, which has been really encouraging to see, actually. So it's, as ever, it's multifactorial, and for us to really turn on the pipelines for surgery, for elective surgery, we have to make sure we have a real strong pipeline of PPE. For example, and making sure that PPE is coming through. They're different type of gowns, basically, and we've started to learn this quite a lot over the last few months, expecting. But I think we're seeing more and more patients. We're seeing more and more patients accessing our normal care. We've got quite a lot of information out there to encourage patients to access the care, and actually the transformation of moving to some of the online consultations, the telephone consultations, so far is working actually quite well. But we've had some great collaboration and cooperation from the public.
Thank you,
Claire. Michelle, Claire and Michelle, I'm hearing a lot of funny noises in the background with Claire. Is that feedback? Have you got another machine on, Claire? Or Michelle, or can you suggest anything? Because it's hard to actually understand what you're saying.
Yeah, I think when Claire had a microphone open previously, it was a little bit fuzzy.
Can you hear me better now?
Yes. Straight away. That's good. Well,
So really, I haven't had another microphone open, but I'm not too sure what happened. But it was really just to give you the relevant assurances. We're seeing a lot of people coming through our door now. A lot of people have confidence to access our services, which is great.
I heard you, but I know you're going to be talking later, and I think if you could try to do something to improve the audio that we're getting this side, because it is quite difficult. Anyway, Chris, who's next?
I had Councillor Nesbitt next.
Okay.
Right. My one of the questions was what Susan asked about the cancer patients, what was happening with them, but you've answered that. The other one is about this COVID-19. Is there any way you can break that down? Because all you keep getting is it's happening. There's more people in the most deprivation of areas that are getting it. I would like to see that broken down, and also the the report you've just given, Liz, is a possibility that could be sent out to the members, because you cannot really read it on the screen. If that's possible.
So in terms of sending the report out, I don't see any reason why that shouldn't be sent out. There isn't anything in there which isn't in the public domain. In terms of the data, I mean, I would love to have data broken down at something below local authority level, and that's really what we're waiting for from either Public Health England or this new joint biosecurity centre, because as I said before, without data at a within county level rather than aggregated at county level, we really have very little understanding about the distribution of infection, across the county. We do have mortality data at a lower level, but that only tells us one bit of the story. So getting those data flows from Public Health England or this new Joint Security Centre is going to be really, really important.
Thank you. Okay.
Chris, who's next?
Well, Claire Riley has.
We're going to respond to that. Wait, sorry, Claire, did you want to respond to that particular thing, or was it a different question?
No, I've got a separate question.
Okay, Chris, who's next then?
I also think I have Councillor Hutchinson again.
Okay.
Hi, Chair. This is the first meeting I've had like this. So with respect, I've noticed that when more than one person has their mic turned on, there's more interference. At one stage, there were 4 mics turned on, and I think it's what happens when that is like that. And also with respect, I've noticed that there's quite a bit of background noise coming from yourself, not from you personally, but your picture lights up quite often when someone else is speaking. So just a suggestion, it might be best if everyone turns the mic off unless they're speaking.
Okay. I mean, okay, fine. If you think that makes a difference, I didn't believe it did, but because I'm in a very quiet background with no background noise at all, so I don't see what difference it would make. But I'll try it and see. Yeah. Right, Chris, who's next?
I had Councillor Wickerby and I think Councillor Jones has got a hand up.
Okay.
Yes, thanks very much, Chair. I have a lot of sympathy in everything that's been said to date, and I can understand where Councillor Dungworth is coming from, because I think it just highlights that everybody is confused and very, very concerned. And whilst I appreciate it's what's coming from government, I'm just at pains to know how we can now ensure people that everything is going to come out at the other end. I hear what Claire says about hospitals, but I am concerned about the people that aren't accessing help for other underlying problems. For example, I don't know, Kath Nesbitt might be able to comment on this as well, but certainly our doctors keep sending texts out basically, and pardon the expression, but sort of almost not touting for business, but they keep saying, we are here, we are here. It's obvious that people are not accessing the GP surgeries because of fear. And I understand that Councillor Jones is going to start this communication group, but I just think that we mustn't forget that there are people out there that sadly could fall through the gap. And I just wonder, and I don't expect an answer now, but just wonder how on earth we can get public confidence back into the NHS system. Thank you.
Yeah, I'm not quite sure how to respond to that. I mean, I completely agree with all of the points that you've made. And I think, as I've said before, I think the whole communication engagement piece is going to be really important to increase people's confidence, because we've spent, the last few months, driving people into their homes, and have now got to a point where actually they're too scared to come out of their homes, even to, access healthcare for some problems which are, going to be really quite acute. And, we know that, for instance, the number of people, admissions for stroke and admissions for heart attacks have really fallen, but, people will still be having strokes and heart attacks. And, the conclusion that we can draw is that actually those people are dying of those conditions when actually there was every chance that they could have survived. And certainly I've, had some really, heartrending anecdotal stories about people who have visited their GP, have been told that they've had a heart attack, but are too scared to go to hospital to seek coronary care support. So, there are going to be a whole range of unintended consequences from this COVID pandemic, and there is a bit of regional work to look at what those unintended consequences are, and to try and quantify them so that we can actually put mitigation measures in place. I mean, the last thing we want to do when we're reopening NHS services is to reopen them in a way which widen the inequalities which have already been widened as a result of this pandemic. So I think we do need to be really mindful of the wider impact, and how we make sure that those don't have an even greater knock-on effect than they already have.
I think just to support what Liz says, if you talk to the consultants, the two biggest worries are stroke and heart attacks, but also mental health and the longer term impact mental health is going to have. And actually we're already starting to see that come through.
Yeah.
I've got Councillor Jones, Councillor Bowman and Councillor Dungworth.
Mine's only a small one. I did have things I was going to say, but they probably more fit into the next item. Mainly, I just wanted to say to just reassure Councillor Nesbitt that actually this paper is actually in the papers, the agenda papers for this meeting. So she's asking if it could be sent out because it's difficult to read on the screen, but actually it has been sent out already. So it is in with the agenda papers. And I think just want to pick up on Claire's point then. About the mental health issue, and we are aware of that. And I think, obviously I'm not part of those national decisions, but part of the easing of that lockdown is the people who are obeying and sticking to the guidelines are struggling, no doubt, and it's really too easy for them, whereas the people who are crowded on the beaches weren't keeping to it anyway. So, this business about the all going out, we shouldn't keep the lockdown. I think we have to remember the people who are suffering from severe mental health issues by being kept in. And that's my personal view, by the way. Right, thank you.
Shall I speak, Chair? Hello. I've got a situation with dental care. A few residents are telling me they can't access dental surgeries and they are suffering in pain, whether with broken tooth or tooth decay. There is an issue about accessing dental care because of the tools that they use for treatment. Can you give me some idea what to tell residents, give them some reassurance that it would be good in the future?
So, I think dental care is one of those areas of care where actually almost everything that they do is an aerosol generating procedure. And so for that reason, dental care has been, significantly constrained. If people can't go along for routine checks, but if people do have a dental health problem, then they should be able to ring their dentist and get some advice. Certainly there is a mechanism for people who really do need a face-to-face assessment to get that assessment through a number of sort of hubs across the county. I don't have a huge amount of detail, but I know that there is a mechanism for people to get either remote sort of care and support, which could be, antibiotics. And certainly there is a mechanism if somebody really needs a face-to-face appointment, then they can get that. But clearly, there is a real risk with a significant proportion of dental interventions, and that's the reason why why a large proportion of dentistry has had to close down. I don't have any information as to when dentistry is going to restart.
Okay, thank you.
Claire Riley has a hand up. I don't know if she wants to add, and then I also have Councillor Dungworth as well.
Yeah, my question was around the Communications and Engagement Board, which I'm sure you would expect me to ask this question in any way. And it's what we need to make sure is obviously each individual organisation has a statutory duty and their own statutory duties as part of that. We also, as the NHS, have to play nationally and also regionally And key, and what's really important is that consistency of message when you're having to change that behaviour. And it's just how are we going to do that with individual statutory organisations, and whether or not we need to take this offline, Veronica and Elizabeth, and find a better way, or figure out a way of where we can coordinate. But the importance and the longer term behavioural change can only happen with consistency of message.
Well, you're going to be part of that board, Claire.
Oh, right, okay. That's fine.
All right, can I come in? First of all, I think it was to recognise that I think our trust and the neighbouring Newcastle Hospitals Trust have both been a lot better than others, including within the region, in continuing with care. So really my question was about just seeing where we were at with that, rather than it being critical, because I am aware that we've continued to care for ongoing cancer patients. I'm also aware that we've started things like breast screening again. But I think it needs to be recognised that I think the response from our hospital trusts have in this area, we've been lucky with that. And I think that other point about the consistency of message, and it ties in with what Veronica was saying. I don't disagree with you, Veronica. The people on the beaches, you know, are ones who've probably pushed the boundaries, and they're younger and they're healthier. I suppose my concern, and it ties in with the mental health, is those people who are more vulnerable, who see themselves as more vulnerable, and now frightened to go out because it is so busy out there. And it, you know, when it was lockdown, you could go for a socially isolated walk and not see anybody. That's absolutely impossible now. So I think even when people have been told they can, there's going to be a real reluctance to do that. I think there's going to be a problem with school refusal, people worrying about going back to work, you know, all kinds of mental health issues that come out of this before you think of bereavement and loss and things as well. But I think Northumberland has been excellent on its messaging, and it's kept that messaging very clear to its residents. Not everybody's listening to it, but it's much clearer than, again, some of the other authorities in the area. And I think we just have to maintain that with our partners and not be pushed into watering it down, I suppose, because of pressure from some places.
Yeah, I mean, I completely agree with you, and I think this is an area where we, you know, should be working across a wider footprint, you know, particularly on across the North of Tyne footprint. But I just, you know, I agree with you. I think the messaging is really important, because we need to start, you know, changing the narrative a bit, so that we can get people, well, at least we can get people to access the care that they need. You know, we have got a bow wave of mental health problems coming in our direction, and certainly that, you know, that's a concern across the North East and North Cumbria ICS, and they are doing a specific bit of work around mental health to, you know, to do a mental health inequality impact assessment, because, you know, we recognise that it's going to be a real issue.
And could I just come in there as well to say, I think Councillor Dunworth, the plan is not to water it down, it's more to ramp it up. And as Claire said, that consistent message right across on everything we do, because the easing of the lockdown actually will still be fine if people would just stick to what the guidelines are and do as they've been asked to do. And I think that's the message we've just got to keep working on. But thank you.
Thank you. I'm conscious of the time. Chris, was there anybody else who hasn't had a chance to speak, who'd had their hand up yet?
No, I don't think I have. Well, I haven't got anybody else.
Right, okay, that's fine. So can I just say to Liz, thank you very much for that report, which I actually didn't even ask her to do till last Thursday. So you must have either had it ready or spent an awful long time in putting it together for us. So thank you very much indeed. It's much appreciated. And we'll move on then now to the next item, which is under urgent business, which was the letter that the Chief Executive wrote to the Secretary of State. I think you've had a copy of it. It didn't come out until late on Friday. So, Kath, I think you're just going to mention one or two things about it for us.
Yes, I am. And Veronica, I don't know whether you want to introduce it or whether or not you just want me to roll on. You're on mute. Veronica, you're on mute.
I've just realised. Sorry.
Sorry.
I get so efficient at switching it off. I forget to switch it on again. What I was going to say, I'd rather just do a brief overview and then leave you to actually take through the detail. And I think, you know, what you've got in front of you there is a picture really over the last few months of where we've been with care. It's not been without problems. I won't pretend it has been, especially at the very beginning, especially with PPE and with discharges from the NHS back into care homes. You know, I think it's like was looking at the track and trace. I think this is it's an unusual situation. I know that they keep saying that nationally. We've not been here before. I think if we could go back to March and start again, we'd do it differently in a lot of cases. But a lot of things we wouldn't. We've done all right. The PPE was a problem. We managed to get on top of that by literally spending a lot of money and donations from businesses and individuals, for which we're very grateful. We've supported care homes. They now get a twice weekly call just to see where they are with that, and obviously supported them too with infection control advice. We've also done the same with the home care providers and as well people who are employing via direct payments. We closed our day centres for working age adults with physical and mental issues at the beginning, simply because parents didn't want were concerned about the safety and basically wanted to keep their family members at home. But we have still supported them. I think you find that in the paper as well. So basically, I think that's what I'd say. One thing I do want to say is that we've actually had no reductions in assessments, and I just want to reassure you on that one, because the Care Act easement did allow for that, for us to reduce our levels of assessments. But as far as Northumberland's been concerned, it has been business as usual. So I just wanted to reassure you on that. Well, I think that's all I want to say, Kath, just to overall view, let you do the rest.
So just Veronica's done a great job of identifying and giving an overview of what we have actually provided to our care homes and care home providers. The letter that is before you is the result of a culmination of significant negative comms or concerns raised quite rightly about care homes nationally and the spread of COVID within those care homes, and evidence that things like asymptomatic transmission was a huge issue, and the government's drive to try and stop the spread. So the week before last, or almost 2 weeks ago, the government requested that each local authority or local area produce 3 things. I'm saying 3, I'm just going to count them on my hand. One was they had to fill out a template which determined what support had been offered to which care homes in terms of infection control, funding arrangements, and clinical support. The other was a narrative explaining what it was that we were doing to help support care homes, and the third was an understanding of the financial support that we had already provided to our care homes over the period of the last 8 to 10 weeks. In addition to that, the government allocated a 600 million infection control fund for local authorities to dish out to our care homes. Based on 75% of that funding would go straight and direct to care homes to spend specifically on infection control. There are some issues about the criteria and how you demonstrate the spend in relation to that, but nevertheless, that there is that commitment to do that spend. So the letter that is before you is the letter that was sent out by Daljit's office on Friday, which had to be submitted last Friday tea time, providing a narrative overview in relation to what we were doing. That letter is also on our website.
It is also, and alongside that website is the information from the template, and also the information about the financial support that has been provided to our care homes. In our narrative letter, we've gone a little bit further, making some suggestions about where we might want to go in the future, but all the letters nationally were submitted by Friday tea time. That is now subject to a regional review. So there's a group of people in the region who are reviewing those care plans, the care home plans, and providing some feedback in relation to that. But this will provide the government with an understanding of what is happening in our care homes, alongside the capacity tracker that all care homes and care providers have to be signed up to. I won't say anything more because I'm acutely aware of the time. But if anybody's got any questions.
I've got Councillor Dunworth, Chair.
Thank you. I think I just unmuted myself and then remuted myself. First of all, I just want to give credit to the staff, both within the County Council and providers outside of the County Council, who I think have been working in the most appalling circumstances over the past 3 months. And however difficult it is for us coping with technology and being stuck at home, I can hardly imagine what it's been like to go to care homes day in, day out. And we need to keep that, I think, in our minds. They've done an amazing job. And I'm pleased to see I've heard from discussions about ongoing support for those workers in terms of their mental health as well, because this is going to take some time. I think, yes, you're right. Hindsight is a really valuable thing, Veronica. But I do think, some things like discharging people from hospitals into care homes and not doing the testing of the staff there was a significant error of judgment. And what we did was we protected the NHS, and our hospitals weren't overloaded like they were in Italy. And I can understand people wanting to make sure that didn't happen, because those scenes were harrowing from Italy. But equally, what we did was we shifted that into the community, actually, and in many ways made it harder to treat and track there. So I suppose a question I've got, I mean, there's so many questions in that document, but I don't feel there's time to do it justice. And I am concerned about things, I'll say this now, being put on as an urgent business item when COVID-19 is a daily business of the council at the moment. So it should have been on the agenda. And I think some of the information we've had could have been provided much longer in advance, so that we would have had longer to look at those written reports. But I'm assuming that less people are we're having less admissions into residential homes, because certainly if my mum needed care, then I wouldn't be thinking of her going into one at the moment. And I suppose what pathway, what plan is there again to build up confidence and to, apart from anything else, you wouldn't want to go into a situation that doesn't feel like a warm environment at the moment, and because of measures that had to be taken, they don't. But we have an aging population, we have a need for residential care, so we need to rebuild that somehow.
Yeah, so that is part of the recovery planning process that we're thinking about, both locally and regionally, as well as obviously the impact of the national agenda in relation to that. We, have seen reductions in the numbers of people in care homes, as well as the reductions in numbers of people who are requesting care home as part of their provision. That hasn't stopped. It hasn't, hasn't completely stopped. We are still getting requests for care home provision, but not obviously in the way that we previously have had. We have got some thoughts and ideas, and they're still in the very embryonic stages of what that support and what that stimulation to the market might look like going forward, and how we ensure that those people who need care home support receive that care home support. And the team are currently working on that, and there is a regional group who are also going to look at that.
Kath, can I ask you something? If I read this report correctly, 29 of our 69 elderly care homes had coronavirus reported, but none of the other care homes have had them. I mean, that's a significant. That shows, presume that it's really allied to the older people, as we already know. But if you're careful in the other care homes, as we seem to have been, we haven't got any. Have I read that correct?
The issue is, Jeff, is that there wasn't the availability of tests to determine whether or not somebody had COVID for outside of the elderly care homes at that particular point in time. So we can't be sure
Okay.
at this point.
Okay, thank you. Have we got any more questions that's burning in people's minds? Because if not, it's really getting on time-wise, and we have to move on. So I'm going to now close the public part of the meeting and go into the confidential part. So would the staff please switch us off? But anybody else has been listening, thank you very much. I'll pause for a few seconds to give time for that to happen.
Chair.
Agree with going to private, you can just raise your hands.
Thanks, members.
And Michelle, are we turning the live feed on?
Everyone.